Over the last 5 years, the landscape has really been changing when looking at options in helping men suffering with symptoms from an enlarged prostate. Today, I am very excited to have urologist Dr. Dean Elterman back for another appearance on the podcast. Today, we will be chatting about office-based minimally invasive surgical therapies, also known as MIST, that are now available for the management of an enlarged prostate. So listen in. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. Making a repeat appearance here today on the Prostate Health Podcast is Dr. Dean Elterman. His initial appearance for episode 30 on utilizing water power to treat benign enlargement of the prostate has definitely been a popular episode with our listeners. Again, he has worked in the area of men's health and survivorship at the Cantor Men's Health Center at New York Presbyterian Hospital, Weill Cornell Medical College, and at the University of Toronto. He is the medical director of the Prostate Cancer Rehabilitation Clinic at Princess Margaret Hospital Cancer Center. Dr. Elterman is a true innovator in men's health and continues to embrace the integration of minimally invasive surgical therapies, also known as MIST, in the management of an enlarged prostate. Dr. Elterman, welcome back to the Prostate Health Podcast.
Great to be with you again, Garrett. Thanks for having me back.
Dr. Elterman, so as a review for our listeners, what does it mean to have an enlarged prostate?
So the prostate is a gland that sits just beneath the bladder, and essentially it's shaped like a donut, and you pee through the middle of the prostate. And so your urethra, which is the tube that takes the urine out of the body, travels through the prostate. And as men get older, the prostate tends to grow. And about 50% of 50-year-old men will have an enlarged prostate. And by the time you reach 80, about 80% of men. And so what happens is you get a restriction or a blockage of the flow of urine, and that can lead to what we call lower urinary tract symptoms, or LUTs. And those can include a slow stream, a sense of incomplete emptying, dribbling, not emptying your bladder. And of course, this could progress to bladder damage, urinary tract infections, kidney problems. And so BPH is a common condition, a benign prostate enlargement, and there are a number of different treatments available, all the way from medications to surgery, and that's really what we're going to get into tonight.
Well, certainly can really cause some trouble there, and also, as we've both seen, some really quality of life issues too. And now, looking back in time at treatment options for an enlarged prostate, really how has the treatment of an enlarged prostate evolved over the years?
So benign prostate treatment, and again, this is very different than prostate cancer, has really evolved over, the centuries, and particularly over the 20th century and now into the 21st century. Historically, there weren't a lot of treatments, and in the early 20th century, there was something called a simple prostatectomy, which was still an open operation where you'd have to make a cut in the lower abdomen, and essentially the prostate would be opened like opening up an orange, and they would scoop out the fruit and then seal up or sew up the skin of that orange. And that's called the simple prostatectomy. Now, that is actually still performed in a number of places for very large prostates, but the evolution really changed when we were able to use telescopes to look in through the urinary passageway. And these, what we call cystoscopes, allowed us to visualize the inside of the prostate. And with some adaptations, we were able to use electricity, electrocautery, to cut away small parts of the prostate. This is called a transurethral resection of the prostate. And it was really pioneered in the 1930s and 40s, and it's still performed to this day. The next big evolution in the treatment of benign prostate enlargement was the introduction of medications. And this was probably about 30 years ago. And these are your alpha blockers, which are prostate relaxers, and your 5-alpha reductase inhibitors, or 5-ARIs, which are your prostate shrinkers. And these relaxers and shrinkers really changed the way how we treated prostate enlargement because so many men did not then need to go on to surgery. The medications were enough. And then moving forward, we've actually now gotten in the 21st century to using lasers, for example, water jets, which we talked about last time with aquablation. And now there's a new category of treatments called these minimally invasive surgical therapies.
So, as a urologist, I think really over the last 5 years, it's been an exciting time with new advances in technology, which, are allowing us to better care for our patients who suffer from these symptoms of an enlarged prostate. And I think it's safe to say we are seeing another paradigm shift now in the treatment of BPH with the surge of, the office-based minimally invasive surgical therapies with the abbreviated name of MIST or MIST. So for our podcast listeners, what is a MIST treatment for BPH?
So a MIST treatment is really a new category of treatments, and it sits somewhere between medical therapy, taking a pill or two every day, and surgical therapy, which is really that transurethral resection or laser transurethral surgery. And these minimally invasive therapies sort of split the difference. They are more effective than medications. However, they have lower side effects and risks than the traditional surgeries. And so you may compromise slightly on how effective they are or how long they last compared to the surgeries, but what you get to keep is a safer profile in terms of side effects. You get to keep a lot of things like sexual function and ejaculatory function, and they can be done without pain in an office setting where you can be in and out the same day without the need for a hospital stay, without the need for a full anesthetic. And so these minimally invasive treatments have really started to revolutionize how we can treat en masse large numbers of men without having to rely on operating room resources and without having to do something which is more invasive and requires a longer recovery period as well.
Well, it's really been great having this new kind of classification of therapies at our fingertips, and for these men. And so what are some of the various different MIST options available now for men?
So the currently available MIST options really come down to two main treatments. There's a new third one, and there's a whole bunch on the horizon. So there were actually a few MISTs a number of years ago called TUMPT and TUNA. These were microwave and needle ablation. So if anyone has heard of them, that was sort of the forebearers of what we're talking about. But those have really fallen out of favor just because they don't tend to work very well and they don't last very long. So when we're talking in a contemporary 2021, the main players for MISTs are the UroLift, UROLIFT, which is otherwise known as the prostatic urethral lift or a pull. And the other is Rezum, REZUM, which is a transurethral water vapor injection. And so we can go into details, but the pull is these are small implants, the UroLift implants, which essentially mechanically tack back the lobes of the prostate. They're very similar to curtain stays. And the Rezum treatment, the water vapor treatment, actually injects a very small dose of steam, so heated water at 103 degrees Celsius. And that heat causes the cells to actually die, and then the prostate shrinks down. And each one of those steam treatments is 9 seconds long. And so those are the two main minimally invasive treatments available. We can certainly go into the details and compare them head to head. Yep. And then the next one that's really come onto the market that was actually FDA approved in 2020 is something called the temporary implantable nitinol device, or the ITIND, ITIND. And that's pretty much a prostate stent. You could think about a heart stent, and the same idea here, where this little device is implanted into the middle of the prostate. It expands. It's left in for 5 days, and it at that time causes ischemia and an opening of the prostate, and then it's removed 5 days later. So you've got your prostate lift, your Rezum steam, and now this new ITIND stent.
Well, again, looking at those three options now, and you kind of explained, some of the mechanism, but, when kind of counseling patients, I think the technology with these treatments is really fascinating. And now what are some of you would say are some of the key differences in how each of these options work in treating an enlarged prostate?
Well, let's focus first on the two main ones. So the UroLift procedure, which has been around just a few years longer than the Rezum, it's done generally in an office. It's still done with a rigid scope. It can be done either with some local anesthetic, some light sedation, some oral tablets to make you relaxed, or some intravenous sedation. The same is true for the Resume steam treatment. They both take around 5, maybe 10 minutes of surgical time maximum, so they're very quick and efficient. They don't require an operating room in a main hospital. They can be done in an office setting with sterile conditions, of course. In terms of their efficacy, so how well do they work? They're actually very, very similar. So I'm not going to say that one is way better than the other in terms of improving symptoms. So we have these standardized symptom scores or questionnaires we get men to fill out. They both improve symptoms very, very close to each other. We see about a 10 to an 11-point drop in what's called the IPSS symptom score. We also see some improvements in flow. We see improvements in quality of life, which is really what we're trying to get at here, is men being happier with how well they pee. And we also see improvements in how well men empty their bladders. They both will preserve erection, so erectile function, so there's no impact on sexual function. And they both preserve what's called ejaculation. And with the UroLift, it's a 0% chance of changing ejaculation. Whereas depending on which clinical trial you look at with Resume, it could be anywhere from 0% up to around, say, 6% of having changes to ejaculation, like dry ejaculation. In terms of the other metric that we look at is durability. How long do these treatments last? And they both have very good 5-year data demonstrating that they last a very long time. The current data seems to have the favor towards the Resume, the steam treatment, has more percentages of men not requiring further treatment. In other words, if you wait 5 years, around 95% of men will not need another surgery if they had a Resume, but that number is closer to, say, 85 to 80% not needing another surgery with the UroLift. So it might start to wear off a little earlier with the UroLift.
And, again, so you kind of touched on, one of the main ones, again, I think, a lot of men are becoming more educated. And as far as some of these side effects, with the TURP procedure and so forth, and, again, you kind of touched on, men looking to preserve that sexual function. I think this has, really been a game changer. I think you'd probably agree with these options stacking up. I mean, I think those numbers kind of speak for itself, with the percentages you mentioned.
Yeah, I think you need to have a little bit of context. So when you do an open simple prostatectomy or a HoLEP, we've also heard about enucleation type procedures. The rate of dry ejaculation, or what we call retrograde, is anywhere from 80% to 100%. It's almost guaranteed. When you look at TURP operations, the rate of dry ejaculation or retrograde somewhere between 70 to 80%. It drops down to about 40 to 50% with a green light laser. There are some modification techniques that have dropped that down even further. There's been a technique called the median lobe only resection that shows an 8%. We know that aquablation that I spoke to last time has around a 12% chance of dry ejaculation. So 100%, 80, 40, 10, and then we get down to around 0 to 6% with the Resume and 0% with the UroLift. So in context, it actually is really quite impressive. And of course, just remember that the medications, alpha blockers like tamsulosin, for example, can cause retrograde ejaculation or dry ejaculation. And you can also have changes to erections and libido with the 5-alpha reductase inhibitors like finasteride and dutasteride.
That was a great kind of overview of that, and I think we're definitely heading in the right direction there. So I know a lot of men are concerned about the potential need for a catheter or a urethral catheter to drain their bladder following their BPH procedures. Now, how has your experience been with some of the different missed options as far as the need for a catheter after the procedure?
Right. So the need for catheter varies depending on the mist. With the iTIN, for example, you don't need a catheter. The device springs open in the prostate, it's left in for 5 days, and then it's removed 5 days later. With the UroLift, it really depends a little bit on how many of these implants are placed. So the average man who has not a very enlarged prostate may only need 2 or 4 implants. And generally, we would send them home without a catheter or maybe a catheter for 24 to 48 hours. And certainly, the chance of them needing a catheter increases if you put in more implants because they had a bigger prostate. With the Resume, you have to understand that what we are trying to purposely do is cause an inflammatory reaction. We're actually causing heat, like a burn on your hand, to go into the prostate to kill cells irreversibly. They will never grow back. So it really is the mechanism that we're trying to create. But if you've ever burned your hand, it can swell. And it's for that reason that we recommend leaving a catheter with the Rezum. However, the average catheter duration is usually around 72 hours for an average size prostate. Sometimes we'll leave them in anywhere from 3 days, 4 days, let's say up to 7 days with very large prostates that we put the steam into. But it depends a bit on the surgeon and what they feel comfortable. But you want to leave it in long enough so that the swelling starts to come down. But my personal opinion is that it's a relatively small inconvenience of having a catheter for 3 to 5 days when the results of a Rezum and the durability are actually very good. And the same is true for a UroLift. If you did have to have a catheter for a few days, it's not the end of the world either. These are relatively short periods of time compared to the long-term benefits you'll have from one of these mists.
Oh, certainly. So, when counseling men and your patients, what are you seeing, in terms of the outcome? You mentioned some of the outcomes, but maybe even some of the side effects when counseling men, regarding some of these mist therapies.
Yeah, so every mist is going to have some side effects, but you have to remember, put in context of what you're comparing it to. The side effects of drugs are long-lasting. As long as you're on that medication, you will always have those side effects. And the side effects of surgery, both in the short term and the long term, are also significant, and they can be long-lasting as well. So the majority of men will actually have no side effects. In all the clinical trials, more than 50% of men having a UroLift and a Rezum reported no adverse events. But the most common things that men do report for either include some blood in the urine or some blood in the semen. They can have what's called dysuria or burning when they pee. They could have some frequency and urgency, so they have to rush to the bathroom. They can have, obviously you could have a urinary tract infection, which is just from the instrumentation. But again, all of these side effects are short-lasting, typically 3 to 4 weeks, and they resolve on their own.
Well, this has really been an excellent review of some of the new and truly minimally invasive surgical therapies available now for men with BPH. Dr. Elterman was kind enough to stick around to chat a bit about how one may go about finding out if they are a candidate or not for these various options. And this is going to be available inside our upcoming Prostate Health Academy. So again, for those that don't want to miss out, make sure to sign up for the wait list at www.prostatehealthacademy.com. So Dr. Elterman, any final thoughts today for our listeners?
I think there's a couple final thoughts. First is, if you think you have BPH, if you have problems peeing, please do say something. We know that in the United States, a full 2/3 of men will not even talk to a physician about having a BPH, and only 1/3 of men go on to treatment, and a fraction of them will go on to medications, and even smaller fraction will ultimately need and get some sort of therapy. So the vast majority of American men are living and suffering in terms of quality of life with these urinary symptoms, and it doesn't have to be that way. And as we have entered into this new 21st century era of mists, minimally invasive treatments, whether it's UroLift, Rezum, or the iTind stent, all of these offer men a great office-based, in and out, covered by insurance option to treat their LUTs, to treat their BPH. And so don't hesitate. There are a number of excellent resources on the websites. The UroLift and Rezum and iTind all have their own websites. Your local physician probably has a website as well. And of course, there are a number of very reputable universities and hospital institutions that have reliable information. So my final message is, it's a pleasure to be with you again, Garrett. And if you think you have your symptoms, do look into it, because there are really great options available.
Well, we really do appreciate you taking time out of your busy schedule to make a second appearance today on the Prostate Health Podcast. You have again delivered significant value to our listeners today. So thank you so much.
Thank you.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/Prostate Health Podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.